If you have type 2 diabetes or prediabetes, you've probably been told that your blood sugar is the problem. But what if I told you that high blood sugar isn't the real issue? The root cause of type 2 diabetes is something much deeper: insulin resistance. Understanding that could be the game changer. It could be the key to reversing your diabetes naturally. Hi, I'm Dr. Kathy Shaw. I'm a Florida licensed chiropractic physician, a PhD researcher, and a professor of biochemistry and endocrinology. I've been treating diabetic patients for over 15 years now. So I'm going to break it all down for you in a way that's really easy to understand. Also, stick around because I'm going to share a free insulin resistance and diabetes guide. How you can use intermittent fasting to take control of your health and do it today. So just click the link in the description to grab your copy. All right, let's get into it. So most people think that type 2 diabetes happens because their blood sugar is too high. But high blood sugar is really just the symptom, and it's the symptom of a bigger problem: insulin resistance. Your resistance to your insulin is what drove your blood sugar up. So let's talk about what's really happening here. Type 1 diabetics don't produce insulin at all, so they need to get it from outside sources. So this is really more of a conversation about type 2. Type 2 diabetics do produce insulin, often in very high amounts, but their cells stop responding to that insulin signal properly. This is what's called insulin resistance. Instead of addressing the real issue, many treatments focus on lowering blood sugar and doing it with more insulin. It's kind of like throwing gasoline on a fire. Giving more insulin to somebody who's resistant to insulin can make things worse. It can actually increase your risk of heart attack, cancer, kidney problems, all the things typically associated with type 2 diabetes. So the real problem is too much insulin over time leads to insulin resistance. Insulin resistance leads to type 2 diabetes. If we focused on the insulin levels instead of just glucose, we would detect and prevent diabetes 10 to 20 years before you are actually diabetic. That's why this is so important. So let's talk about how insulin resistance develops. It doesn't happen overnight. It builds up slowly, very often without symptoms. You don't even know it's happening. So here's how it works. Every time you eat, especially a high-carb meal, your body releases insulin to help deal with that sugar, to get it into the cells to make energy out of it. If you eat constantly or snack, your insulin never really has a chance to drop. Over time, that constant high level of insulin makes your cells resistant to it. It's like if I were yelling all the time, you just tune me out at a point. That's the idea here. So what happens is your cells become resistant to that insulin signal, and it makes your body make even more insulin just to get the sugar into the cells, get your sugar stable. Kind of like if I'm yelling all the time and you're ignoring me, I'm going to want to yell louder to try to get your attention. So exactly the same kind of thing. So this insulin cycle, sugar insulin cycle, continues until your body just can't make enough. So you need more insulin to get the job done, and more and more and more. You make it as long as you can. But at a point, your body just can't do it. So your blood sugar then rises. That's when you become type 2 diabetes. So the key takeaway here is that by the time your blood sugar is high, you've probably been resistant to your insulin for years, probably a decade or so. So now let's talk about how fat cells play into this, what role they play. Insulin resistant isn't just about sugar. It affects fat storage. We tend to focus on the sugar, but there's more to it than that. So fat cells can only grow so much. They can go up to 4 to 5 times their normal size. Then they reach a limit. When they reach that limit, they become insulin resistant as a protective mechanism. You've packed more and more fuel into them, expanded them, but they hit a limit. So at that point, they don't keep expanding, they burst. When they become insulin resistant, they leak fat, they release pro-inflammatory compounds like cytokines. They release the things that inflame the rest of your tissues. So these cytokines trigger increased blood flow, inflammation, all of the things that can worsen insulin resistance, increase your risk of heart disease, metabolic disorders, cancers, kidney problems, eye problems, just everything. Everything that we associate with type 2 diabetes. So this is actually the reason that obesity and insulin resistance go hand in hand. It's not just about weight though. It's about what that extra insulin is doing to your body. So let's talk about a really simple and really powerful tool for managing this, fixing this. So imagine insulin is a lock and key system. When you're insulin resistant, your cells stop responding to the insulin key. So the sugar stays trapped in your blood. It's like if your key won't fit your door, you're trapped outside your house. So intermittent fasting can help reset this system. So the way that works is you're giving your body a break from the constant insulin spikes. So going back to our yelling analogy, if I'm just yelling and yelling and yelling, then I give you a break from it. It's like, oh, it's quiet here. It's a break. You notice that. So if we give your cells a break from constantly being bombarded by an insulin signal, they notice that. They become more sensitive to the insulin signal, more responsive to it. So by lowering our insulin levels overall, we can make our cells more sensitive. What you're going to do is you're going to force your body to burn that stored sugar and fat instead of relying on a constant food intake, instead of wanting to graze all the time. So if you do it consistently, intermittent fasting can restore your sensitivity, can actually help you lose weight, and it can put your diabetes into remission. So it's a really nice tool for becoming sensitive to your insulin again and getting your type 2 reversed. So if you want to start intermittent fasting, let's talk about how to do that. So if you're ready to take control of your health, there's some easy ways to start intermittent fasting. And keep in mind, intermittent fasting is not total starvation. It's not like I'm suggesting don't eat for days and days. So let's talk about the first method. It's called the 12-12 method, meaning you eat for 12 hours and then you don't eat for 12 hours. So you can eat from, say, 6 a.m. to 6 p.m., just don't eat until 6 a.m. again. Not a huge window, really, 'cause you'll be sleeping during a lot of that, but it's giving your body a really nice break from the insulin. Another technique you can use is the 16-8 method. You fast for 16 hours, meaning you eat within an 8-hour window. Still lots of time to eat. And when you think about our traditional way of eating breakfast, lunch, and dinner, and not eating again until breakfast the next day, breakfast, break fast, that's really what traditionally we've done in terms of our eating schedule. This one's actually really, really effective for lowering insulin levels. Another thing you can do is the 5-2 method. Eat normally for 5 days, then reduce your calorie intake for 2 days. Just don't pick 2 consecutive days. Space it out a little bit during the week. This one's probably not as effective as the other two, but it might be an approach to ease into it. So remember again, fasting is not about starvation. It's about giving your body a break and giving it the time it needs to heal. 8 hours or 12 hours, 16 hours without eating, especially when you're sleeping, a large part of that really isn't a big deal when you think about it. So, if you're serious about reversing your insulin resistance and taking control of your health, I've put together a free guide to intermittent fasting. It walks you through everything step by step, starting out very slowly and working your way up to a little bit more of a longer fast. If you are interested in it, click the link in the description, enter your email, I'll send it to you right away. This is your time to reclaim your health and feel better than ever. So, also, I'd love to hear from you. Have you struggled with insulin resistance? Have you tried intermittent fasting? How did it go? What's your biggest challenge in managing your diabetes? Drop a comment below and we can talk about it. I'm happy to answer any questions as well. If this video helped you, please hit like, subscribe, turn on your notifications so you never miss a new video. And bottom line is, you've got this. You can do this. I really, really believe in you. See you in the next video.